The fifth is Germany. Dr. Christian Thede. Dr. Thede is a general medicine doctor of Germany. He has practiced the TCM for 35 years in his own clinic. Dr. Thede is a lecturer in acupuncture and Chinese medicine at the International Society of Chinese Medicine, and a long-time lecturer in Chinese medicine at the University of Witten-Herdecke. He is co-author of the book Guide for Chinese Herbal Medicine Formulas. Nowadays, he has published articles on COVID-19. The first one is a three-stage treatment protocol for the treatment of the acute COVID-19 disease with Chinese herbal formula, including possible modifications based on the Chinese governmental guideline for COVID-19 treatment, the 7th edition. The second is the treatment of post-infectious problems, especially of chronic fatigue syndromes. Dr. Thede's presentation title is COVID-19 in Germany, Situation and Perspectives of Public Health Efforts and the Chinese Medicine Treatment Possibilities.
Hello, everybody. This is Christian Thede speaking from northern Germany. Thank you for your invitation, Dr. Mi-Kyuk Sung and Dr. Moon-Suk Choi, and greetings to you as moderators and as well as to all the other speakers and everybody who's watching and listening. Please let me start my presentation. I just share the screen. I'm invited to tell you about the situation of COVID-19 in Germany. The developments, public health efforts made by the government, and the second part of our presentation will be about Chinese medicine and the treatment of COVID-19 in Germany. I will tell you something about the framework in Germany, the associations who are supporting Chinese medicine in Germany, as well as the possible degrees you can get here and the journals with Chinese medicine content. I will tell you a little bit about the sources and guidelines we used to gain knowledge of the treatment of Chinese medicine and COVID-19 cases and what we tried to do here. First, the developments in Germany. Little remark, I have quite a bit of pages, and I will go through a thought rundown of some of the pages. If you want to know more about it, you can look at the PDF file that should be made available to you by now. We started in January 27th, when the first documented COVID-19 case or SARS-CoV-2 case in Germany was reported. And actually now we have a little bit more than 1 million confirmed cases and sadly more than 16,000 deaths which are related to COVID-19. This diagram shows you we had a peak of infection rates in early spring. That's the left one. Had a comparable low rate of infections during summer with an increasing rate up to exponential increase in October. And now we have kind of a steady state with about 20,000 to 22,000 reported infections per day. And slowly the intensive care units and a couple of clinics are filling up. That's to worry. The public health efforts are mainly instated by the Robert Koch Institute, that is our governmental institution for infectious diseases. Until end of February, there was declared a low risk, but when in March we had our first peak of infection rates, there were contact restrictions as well as a lockdown that meant schools were closed and all non-essential services. Restaurants were closed, no more cultural events, and so on. Since April, face mask wearing was declared mandatory, partially. And during the summer, we had a generous slackening of restrictions with a hotspot strategy, means restrictions depending on number of cases and depending of special regions where the cases increased. Since October now, we have again this exponential increase of infection rates, and now we have a kind of a lockdown light. Schools are open, but restaurants and cultural events are not allowed to open. That will be suspended a little bit temporarily during Christmas days and New Year. And we have some special issues in Germany compared to you in South Korea. I think we had no pre-existent pandemic strategy. You could say we did not learn anything from SARS in 2003. In early spring, we had a lacking availability of face mask, for example, and other articles. Our contact tracing is not as effective as I think it is in South Korea, Japan, or in some other regions in East Asia, because of our legal limitations and because of public resistance. We have a Corona warning app, but the use is voluntarily, and it doesn't use personal data, and that limits its effectiveness, I'm afraid. There's also partial public resistance against wearing face masks, against social distancing and mobility restrictions. That makes things difficult. There are other issues that are possible not typical for Germany, but are very common. Suffering due to social isolation, economic crisis, and lockdown times. And what's an issue on public discussion is restrictions of constitutional rights. And we have also developed, not me, but some people have developed conspiracy theories such as Bill Gates has invented COVID-19 and has distributed all over the world and is planning to chip us all and something like that. And these people sometimes go together with political extremists, which is a social and political problem in Germany. And now we have the prospect of vaccinations, and people hope sometimes that with the start of the new year, Corona will just end with starting of vaccinations. So let's change the subject to Chinese medicine in the treatment of COVID-19. You have to know that Chinese medicine is no official part of public health system in Germany. It's privately organized. It's a private decision for people to seek treatment with Chinese medicine. And Chinese medicine practitioners are medical doctors, also Western educated medical doctors with a postdoc education. In addition to that, are the so-called naturopaths that are non-medical doctors with a governmental license to treat people's illnesses. It's a bit limited, but you can practice Chinese medicine with this degree. There are some associations, like my own association, SMS. You could translate it as Association of Chinese Medicine, which offer an education in Chinese medicine. Is education organized as part-time studies over 5 to 8 years, and leads to our so-called certified physician of Chinese medicine. There are some master degrees possible in Germany, also exclusively part-time concepts. And we have one master degree, which is an independent German master degree granted by the Technical University Munich in Bavaria. The other possible master degrees are granted by TCM university branches from Shanghai and Zhejiang. And yeah, I personally am of the opinion that these degrees are at least partially China dependent. We have some journals where Chinese medicine content is published in. These are listed here. You can look them up later, perhaps in the PDF files. The sources which we use for our knowledge of treatment of Chinese medicine for coronavirus disease is this guidance for coronavirus disease, which, as is my understanding, you're well aware of, and call it just the 7th edition. I will do that also on the following pages. And other sources I personally used are listed on this page. Please look it up later. I won't go into the details because of the lack of time. This is a list of observational and case studies reporting the effectiveness of Chinese medicine concepts in the treatment of COVID-19. I'm aware of that you have to look a little bit carefully on the results of those publications. But all in all, it seems that usage of Chinese medicine versus COVID-19 in different stages is at least worth a try. How did we develop our concepts in Germany? They're based on the 7th edition, of course, and some of the additional sources I mentioned. And it's also based, of course, of pattern identification, interpretation of signs and symptoms according to the Chinese medicine theory. There's also been a pragmatic approach, just like in China too. Some people offer patent medicines for sale as pills. For example, this clearing pill with forsythia based on Inchao-san. And for later phases, the well-known Qingfei Paidutang, I assume that you're well aware of this formula, and that is mentioned in this page. Again, I won't go into the details. I think you know it, and it's part of the observational studies that report a degree of effectiveness of Chinese medicine in the treatment of COVID-19. In my publications, I tried an approach according to signs and symptoms based on what most people think in China to be the major pathology of COVID-19, which is toxic epidemic dampness, with the following developments. I won't go into the details on this page as well. Please look it up later. What the result is no guideline. I wouldn't call it that because TCM is not an official part of public health in Germany. I would call it recommendations. These recommendations are part of some of the publications in Germany, sadly only in German language. I made some translations if someone of you wants to look it up. The recommendations are restricted to certain stages. I would only tell about the pneumonia stages and restricted to mild cases in mostly outpatient care situations up to moderate cases, maybe still an outpatient care situation or hospitalized patients. You will never see, not at these times at least, patients in intensive care units in Germany who are treated with any kind of complementary medicine or traditional medicine, Chinese medicine also. That will simply not happen for some time in the future too, I think. So the treatment goal is not to treat very severe cases, but to avoid them. My approach was to offer 3 recommendations for 3 main clinical conditions, which I will list up shortly. One of it is accumulation of damp flame obstructing the lung, early stages of pneumonia without heat signs. And please look up the special symptoms later. I think you are familiar with them. The proposed formula for this condition is based on 3 classical formulas, Hua Qiang Zhengqi San Ma Hong Tang and Ting Liu Da Zhang Xie Fe Tang. You can over the list in later times watching the PDF files. The concept was to create 3 basis formulas and give some modification possibilities. The next proposed formula is for a condition of damp heat affecting the lung. So not only dampness problems, but also heat signs. And the basic formula for this I proposed is based on Ma Xing Yigan Tang and San Ren Tang with additions, and also some modifications given for this condition. And the last commendation for clinical cases for a little bit more severe and advanced clinical cases is heat and toxic stagnation blocking the lung. A formula given is based on Ma Xing Shikantang with additions, and on this page you can look up to the given and proposed modifications for this condition. We have some good experiences in Germany with this concepts. I had some telemedicine cases. I had some cases other medical doctors treated with my advice, and from the feedback I got, all patients with these concepts are well up to now. But sadly, we have no observation studies ongoing in Germany. So after acute stages of COVID-19 or after infections and without any symptoms, acute symptoms are the well-known problems with deficiency states or persisting pathogens. I won't go into these details. That's I think quite common knowledge how to treat these conditions. I want to throw a light on one special condition I observed more often in the last months, that are signs and symptoms were similar to chronic fatigue syndrome following infection with Epstein-Barr virus. And often the clinical appearance could, in my opinion, be interpreted as a Shaoyang disease, and consequently treated with different variations of Xiao Chao Tang. And the results are very promising so far. I observed several cases of fast and complete recovery with these modifications of Xiao Chao Tang. So that has been my short run-up of COVID-19 in Germany in general, and possibilities of Chinese medicine, especially in Germany in the treatment. So let me thank you for the kind invitation again, and thank you for your patience. Thank you for watching and listening. Goodbye, stay healthy.